This is All India Radio. In the program Spotlight now, we bring you an interview with Secretary, Ministry of Electronics and Information Technology, Shri Ajay Prakash Soni on Arogya Setu app. Interviewer, AIR Special Correspondent, Mattu JP Singh.
To combat the coronavirus pandemic, government launched Arogya Setu app. This app has helped not only in self-assessment of risk, but also helped in containment of COVID-19. We have with us Secretary, Ministry of Electronics and Information Technology, Mr. Ajay Prakash Soni with us. Sir, Arogya Setu app has been downloaded by more than 9 crore smartphone users, but there are certain apprehensions that it compromises privacy and data. So if you could explain to us the privacy policy and the data sharing protocol.
This particular app has been designed to have privacy by design, inbuilt into the app itself. And in my experience, I have rarely seen this kind of attention being given to privacy and to making it very, very transparent to all the users. And whatever data is collected by this app, it is very clearly indicated by the privacy policy as to what that data is for, how it is collected, how it is stored, where it is stored, how it is used, with whom it is shared, and after the pandemic, how this entire data will get deleted. So for different categories of data, I think very detailed description is given to the users in the privacy policy. And then there is also a data sharing protocol that has been approved by the Empowered Group for Technology and Data Management for the purposes of handling the pandemic. So all of these make it very, very clear to the users as to what data would be collected and give them complete assurance that this data will be used only for the purpose for which it is collected. It will be used primarily to help them, to help their neighborhood, to help their community, to help their city, to help the people in India to fight the spread of the pandemic and to ensure that they also get access to the right services, to testing, to hospitalization if it is required, and primarily to be able to fight the pandemic.
Sir, related to this is one basic question that the efficacy of this app depends on switching the Bluetooth and the GPS on, which most people do selectively. So how does this impact the findings of the app, or what is its rationale?
It is a fact that switching on the Bluetooth and GPS makes it effective. Bluetooth is required to be on if there are two users, both of whom are using Arogya Setu. If both of them have their Bluetooth on when they are in close proximity to each other or when they happen to meet each other, each user's phone is given a device ID. So the name of the user or the number is not shared anywhere. The device ID which is shared by the two phones, and along with that device ID, the phone is also able to capture for how much time another phone was nearby, how far was it, how much time that phone was in close proximity, and that entire data of Bluetooth contact is encrypted and stored on the user's phones themselves. It is not used anywhere else. It is stored on the user's phone. Now, we have more than 10 crore users today, but only in case of those Arogya Setu users who test positive sometime in future. Only for them, this data is then taken to the server. It is decrypted, and then from that we get to know who else might have been at risk. So, for instance, if supposing you and I happened to meet a week ago when I was buying vegetables and you were also there in the same shop. So, you will not know who I am, I will not know who you are. We will not be able to remember that we even met. But supposing one of us tests positive, then from the taking the data from his or her phone, the app is able to determine who else had come in close contact during a period in the past. The person might have been infected and might have spread the infection, and uses that information to alert others who might be at risk.
So in this given situation, what you just said, supposing my Bluetooth is not on, then how will this finding go about?
It will not. It's very important that users keep their Bluetooth on. They keep their location services also on. When you or any one of us makes use of Arogya Setu app, it is not so much to protect ourselves. It is to protect the other people that we encounter. If I download Arogya Setu and keep my Bluetooth on, I am extending a certain digital defense, I am extending a certain protection to the people who are near me, my family, my near and dear ones, people I come in contact with as close contact, people in my workplace along with whom I will spend time. So I am then making this effort to extend them a defense. Supposing I was to be infected, not know that I am infected, and by unwittingly if I am spreading the infection, I will not know because it is asymptomatic in most cases. But by making use of this technology, I am giving an opportunity to technology to actually be able to alert others that they might be at risk. So the same way, it is others who use Arogya Setu and use Bluetooth, keep it on, they in turn are extending the protection to me. So it's something which everyone needs to do to understand what is their responsibility towards everyone, especially towards our very close, near and dear people. If we want to be able to protect them, if we want them to be able to get early alerts, then it is our responsible behavior which requires us to download, install and keep this app working.
Yes, sir, you rightly explained it and now it becomes very clear, sir. So if we go a step further, how is exactly the risk assessment done by the Arogya Setu app?
Arogya Setu app, as I explained earlier, only in case of a person who ICMR tests indicate as COVID positive, it is only for such Arogya Setu users that the encrypted data which is stored on the user's phone then uploaded to the server. From that we decrypt the data. From that the app determines who else was in close contact. They also determine at what distance you might have been from a person who was potentially infected at that point of time and how much time did you spend together. So if it is typically the distance which is seen as a distance and time combination which is seen as a benchmark, is that if you have been at a distance of 4.9 feet or 1.5 meters, say about 5 feet from each other, and you have been in that kind of a contact for about 10 to 15 minutes, then there is some risk of your having got infected. Phone will not know, the app will not know whether both of you were using masks at that time, whether you were generally taking precautions, but it will only be able to calculate if there is some risk of having, you were close enough to an infected person that you might have risk. Now what do you do when you get this kind of an alert? We expect you to first of all be cautious, take precautions. Take care that in case you are infected and not showing any symptoms, then take precautions so that you do not end up spreading the infection to anyone else, especially to elders, especially to people who have other comorbidities, to your near and dear ones. Just take precautions as if the same precautions that you would take in case you were infected. Now, if the symptoms appear, be alert. Do not then treat your symptoms very lightly. Sometimes if you have only cough or you have very light fever, in a normal course you would tend to take it quite lightly. But if you have received a Bluetooth alert and then you also develop some symptoms of cough or fever or breathlessness, take it very, very seriously. Reach out for testing, reach out for help. Early medical intervention can help save lives. Early medical intervention can make sure that this disease does not end up harming you or harming others.
As you just explained, sir, after the risk assessment, how this app guides the person to do what next if he or she comes in the high risk category. So this app is also programmed to be fault tolerant. How does this system work?
Fault tolerance is in the sense that this app also gives you a chance to do self-assessment. In the beginning when you register, the app prompts you to do self-assessment of your risk level. It asks you very simple questions about what is your age, gender, do you have any comorbidities like hypertension or kidney-related ailments or some of the other ailments that are considered to increase your risk of harm in case you get COVID-19 disease. It also asks you whether you have experienced 3 different symptoms or any one of them, which is cough, fever or breathlessness, or a combination of these. Based on this, it also asks you what your travel history has been, whether you've been to come back from some foreign countries. So that combining all this data, it then arrives based on whatever you have given as your input. It then assesses your risk level based on that. And if you, for instance, have comorbidity and you also have 2 of the 3 symptoms, then the app may decide that some further action, that you are asking for help and that help is warranted, and then might trigger some mechanism by which you can be connected to the National Health Authority and to local health authorities so that they can then provide you guidance and help. question of fault tolerance is that a lot of people ask, what if the user doesn't answer these questions in an honest manner?
Yes, exactly.
Even in those cases, that is where I say that the app is very fault tolerant. It's okay if you have not answered it in a completely honest manner. The moment you have some symptoms, please take them seriously. Please use this for self-assessment. Please come out with and this gives you an opportunity every day. It gives you an opportunity every minute. Whenever you feel that you may require some help, please do go through the self-assessment. Self-assessment will only help you. It will help others in your family. In case you have some risk of having the disease, whether or not the app has alerted you, there is a pandemic which is there. There is an epidemic. There is a virus which is there. This virus has been spreading. Actually experience symptoms like cough, fever or breathlessness or a combination of those. And especially if you are of a higher age group or have comorbidities, then do please make use of this facility of self-assessment and reach out for help. Not only through the app. There is also a helpline number which is given in the app, 1075, which you can call up. And in some way, early recognition of the symptoms helps you get tested early and helps you get medical attention early. And we have seen that, mortality is much higher in those cases which come out towards the last stage. They come out only when there is sometimes they experience cough and light fever for a few days. They ignore this. They come out with the symptoms when they can no longer be ignored, when they have breathlessness. By that time, it might be a little late. The risk then to yourself, and because you have not been diagnosed in time, of having spread this to your family members and near and dear ones, I think that risk goes up. So my request to everyone is to make use of this. This is a wonderful digital defense that has been erected. It has been contributed to by some of the finest minds in India, both in the private sector and in the government. And it's a tool which is designed to help you. It is designed to help India in tackling this epidemic. It cannot stop the spread of the epidemic, but it can help slow it down. It cannot stop harm from happening, but it can reduce the amount of harm which happens on a collective basis within family, neighborhood, city or across the country.
As I rightly said, Arogya Setu app will be available on feature phones also. How will this help in bringing more people on the platform?
Actually, Arogya Setu app by nature will not be available on all the feature phones. There are some feature phones which are called smart feature phones, which have the ability to use apps. From one of the telecom service providers, there is a large number of phones which are there in the market which have the ability to actually make use of downloaded apps. It's on a different operating system, and now this Arogya Setu has been made available on 3 operating systems so far, on Android, on iOS, which is on Apple phones, and on KAIOS, which is on the phones which are there in the market from one of the prominent telecom service providers. So all of these will be able to make use of this app, but those that do not have this app, there is a helpline number. One number is 1075, which is available to everyone to call up and to seek help. And there is another number called 1921. 1921 is a service where you can give a missed call. You will receive a call back, and through the interactive voice response system, IVRS, you will be asked the same questions that you would otherwise be asked through the app. And once you give responses to those questions, once again we try to connect you to the National Health Authority, to people who will call back, who will ascertain through a call what were the symptoms. They might be able to ask you more questions. If it is required, they will connect you to a doctor. The doctor will then talk to you and ascertain your symptoms and sort of indicate what is the further action to be taken. And then that information, that guidance is given to you, that is also passed on to the state health authorities and district health authorities, so that then they can reach out and actually extend help to you.
Thank you, sir, for joining us on the program.
Thanks a lot. Thank you.
You were listening to an interview with Secretary, Ministry of Electronics and Information Technology, Shri Ajay Prakash Soni, on Arogya Setu app. Interviewer, AIR Special Correspondent Mattu J.P. Singh. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our website newsonair.com. You may email your opinion about this program at airnsdtalks@gmail.com.